Babe Kauai Bogue is a therapist living and working in San Francisco. At 37 years old, she has a master's degree, a PhD, and a successful career.
I grew up like 250% below poverty level, and I knew at a young age with a single parent mother, and a lot of my friends had single parents, that I wanted to be in a place where I could provide for children alone. So when I was 25, I decided to go to graduate school.
Grad school, however, is expensive, and a six-figure debt meant plans to start a family had to wait. But just as she was almost done paying, the pandemic struck.
I was 36 when the pandemic started, and I feel like I was stripped of an opportunity to meet people and to date when I was actually finally ready to do that.
Around the world, social restrictions and uncertainty from the pandemic have disrupted baby-making plans.
We've been able to see pretty clearly that in some cases fertility has dropped, apparently for this reason, that people just hesitated in the time of a pandemic to have children.
But the pandemic's long-term impact still remains unclear. The world's population growth rate has been declining for the past half-century, particularly in developed countries with lower mortality rates, easy access to birth control, and higher costs for raising families. The concern now is that the high number of deaths from COVID-19, coupled with fewer babies being born, could make things worse for countries where aging populations have been outpacing new births, putting even more pressure on economies and social support systems. Falling fertility rates across Europe and Asia are threatening jobs and economies. Last year, China and the US saw the slowest population growth in decades. Birth rates are also declining in India and Mexico, countries long known for robust population growth.
So when you go to a point where you have not just population aging, but extreme population aging, which occurs because a fertility rate of below 1.5 children per woman, that if that's maintained for several decades, that starts to produce really rapid population aging and eventually population decline. That produces a kind of imbalance that's more difficult to deal with.
To defuse this demographic time bomb, governments have tried to incentivize baby making and raise the age of mandatory retirement. But Babe Kauai Bogue faces a different kind of balancing act.
There's so many systems and structures that are extremely patriarchal, that don't take into consideration women's careers, their lives. And had I been a 25-year-old who was supported by my partner, who was a man, to continue my career, I probably would have had kids by now.
It's a common challenge for women made worse by the pandemic. The question is whether COVID-19 is just delaying parenthood or if it will have lasting consequences on a world population already under pressure. Liling, CGTN, New York.